common cause of bed sore is option A immobility, option B nasogastric tube feeding, option C fracture of forearm, option D vomiting. The answer is option A immobility. Risk factor of bed sore: immobility, incontinence, lack of sensory perception, poor nutrition and hydration, disease condition affecting blood flow. Immobility due to poor health, spinal cord injury and other causes. Incontinence, skin become more vulnerable with extended exposure to urine and stool. Lack of sensory perception, spinal cord injury, neurological disorder and other condition can result in a loss of sensation. An inability to feel pain or discomfort can result in not being aware of warning sign and a need to change position. Poor nutrition and hydration, lack of nutrition lead to skin breakdown. Disease condition affecting blood flow. Diseases such as diabetes, vascular disease increase the risk of tissue damage. Causes of bed sore: pressure, friction and shear. Complications of bed sore: cellulitis, bone and joint infection, cancer, sepsis. Cellulitis is the infection of the skin and connected soft tissue. It causes warmth, inflammation and swelling of the affected area. Patients with nerve damage often do not feel pain in the area affected by cellulitis. Bone and joint infection. Bed sore causes joint infection. This infection can damage cartilage and tissue. Cancer. Long-term non-healing wound can develop into a type of squamous cell carcinoma. Sepsis. Rarely, skin ulcer lead to sepsis. Normal saline 0.9% is an example for. Next question. Normal saline 0.9% is an example of. Option A hypertonic solution, option B hypotonic solution, option C isotonic solution and option D saturated solution. The answer is option C isotonic solution. Isotonic fluids are IV fluids that have same osmolarity as intercellular fluid. This means that IV fluids should not cause any significant net fluid shift into or out of the cell. Example of isotonic fluid: 0.9% saline, ringer lactate. Hypotonic solution. Hypotonic solution are IV fluid that have lower osmolarity than inside the cell, which causes fluid shift into the cell. Example: 0.45% NS. Hypertonic solution. Hypertonic solution are IV fluids that have higher osmolarity than inside the cell, which causes fluid to shift out of the cell. This leads to cell dehydration and shrinking. Example: 3% normal saline. Next question. Absence of hydrochloric acid in the stomach. Option A hyperchlorhydria, option B hypochlorhydria, option C achlorhydria, option D hypochondriasis. The answer is option C achlorhydria. Women should increase daily intake of calcium to prevent. Option A coronary artery disease, option B atherosclerosis, option C osteoporosis, option D Parkinsonism. The answer is option C osteoporosis. Daily requirement calcium for women 19 to 50 years need 1000 mg. Age more than 51 need 1200 mg. Causative organism of Koch disease. Option A Mycobacterium diphtheria, option B Mycobacterium tuberculosis, option C Mycobacterium leprae, option D Streptococcus aureus. The answer is option B Mycobacterium tuberculosis. Why tuberculosis also known as Koch disease? Because Robert Koch discovered cause of tuberculosis. Question: alteration in mood and affect consisting of sadness appropriate to loss is termed as. Option A apathy, option B labil mood, Option C, grief. Option D, depression. The answer is option C, grief. Grief is a series of intense physical and psychological response that occur following a loss. Stages of grief. According to Elizabeth Kubler-Ross, the stages of grief are denial, anger, bargaining, depression, and acceptance. Denial, refusal to believe the loss has occurred. Anger, experiencing anger after the loss, may blame themselves or others. Bargaining, this is the third stage, involve the hope that individual can avoid cause of grief. Example, negotiate with God for extend their life. Depression, feeling of sadness, regret, fear, loss of interest. Example, refuse visitors. The final stage is acceptance, the accepting the reality. Japanese encephalitis vaccine administered through option A, intramuscular route, option B, subcutaneous route, option C, oral route, and option D, intradermal route. The answer is option A, intramuscular route. Japanese encephalitis vaccine protect from Japanese encephalitis. Japanese encephalitis virus transmitted to mosquito. Incidence of Japanese encephalitis are highest in some states such as Assam, Tamil Nadu, Bihar, West Bengal, Goa, and Karnataka. Japanese encephalitis vaccine is a part of universal immunization program in these states. First dose given at 9 to 12 months and second dose given at 16 to 24 months. Fear of open places is called option A, xenophobia, option B, claustrophobia, option C, agoraphobia, option D, ailerophobia. The answer is option C, agoraphobia. Agoraphobia is a fear of open spaces. Xenophobia is fear of strangers. Claustrophobia is fear of closed spaces. Ailerophobia is fear of cats.